My name is Daniel Bennett. I'm from the University of Chicago. And so my research interests are in public health in developing countries. So I'm interested in public health problems, malaria, diarrhea, uh, disease outbreaks, epidemics, and then thinking about the way in which information is transmitted, how people learn about disease problems or technologies to resolve them, and how people deal with externalities that arise because of disease and because of kind of the interactions between people with communicable diseases. So some of my earlier work deals with the impact of clean water on sanitation behavior and diarrhea in the Philippines. And so this is kind of the closest thing I have to the topics that we've been discussing. This paper has kind of explores the hypothesis that people change their sanitation behavior when they receive clean water, so that when you have a protected water source, you don't have to be as careful about keeping, using the latrine or keeping the area around your house clean and clear of defecation, because your water source doesn't depend as much on maintaining a clean environment. And so this I found some evidence for this in the Philippines, and so it kind of has caused me to have an interest in, more broadly related to sanitation, kind of how social norms are important for people's sanitation behavior, and how those norms are formalized and how they're enforced and what causes them to break down. So some of my other work relates to the SARS epidemic in Taiwan. I don't know whether this is especially germane to the audience, but just to kind of give you a sense of where I'm coming from, is kind of thinking about there's this big health shock because of the SARS epidemic, which causes people to stay away from the hospital because they're worried they might catch SARS from going to the hospital. And so, then I investigate how many additional people died because they didn't go to the hospital during that period because they thought that they might catch SARS. And actually, it turns out that it's a non-trivial number compared to the number of people who actually died of SARS. So just to give you a sense of what would be interesting questions for me, as I kind of said, social norms are interesting, and particularly with respect to sanitation. And so this would play out in terms of investigating the effectiveness of community-led total sanitation, which is kind of aimed to improve social norms or establish social norms through community action. And then another area that I'm interested in is learning about hygiene and how people formulate beliefs about hygiene practices such as hand washing or even sanitation practices like latrine use. And it seems to me that in a lot of traditional communities, people are resistant to these messages because they don't really understand or don't believe in kind of germ theory of disease methods of disease transmission. So if you don't subscribe to those approaches, then you're not going to find a message that you should wash your hands to be very compelling, because that kind of assumes that you understand why there shouldn't, you don't want to spread pathogens across people. So how can we improve compliance with hygiene messages, and what is it that makes people change their beliefs about these sorts of things, and what are the implications of that for health and for diarrheal disease?
Leo Feler from Johns Hopkins University. Some of the issues that I'm interested in looking at are water and sanitation, slum areas, electrification, affordable housing, and then I've done a little bit of work on banking and credit. What I'm really interested in is looking at some impacts on in-migration. If you actually make certain areas better off, do you actually just bid away those improvements because more people migrate into these areas and create more congestion? So that's one of the things that I'm looking at. Previous research experience, I've looked at servicing in Brazil, on the favelas in Brazil, and what is the politics of of providing water and sanitation to these slums. And there I was basically looking at how during dictatorship, wealthy cities really did not want to provide water and sanitation, because if they did so, more poor people would move into these slums, and the elites of the city didn't want this. And how under democracy, once voting became mandatory, how these slum dwellers actually started getting services as a result. So that's one project. Another project that I have is measuring the impact of national policies on local economies. So I'm looking at how the privatization of banks in Brazil, how this actually affected local economies. And the idea of this paper was really to see, well, what's the effect if we phase out a place-based policy that has been in effect for several decades, right? So one of the interests of this is, are these effects of an RCT, for example, are they going to be sustainable once the intervention is no longer continually in place? And one of the things that I discussed with one of the practitioner organizations is, if you actually create something like a community meeting to educate women and to help them advocate for their rights and services, are these effects going to be sustainable once you are no longer hand-holding and organizing these meetings? Do any initial effects persist over time? So one of my big interests is on sustainability of public policies. A few other things that I'm interested in is measuring local spillovers and externalities. So to what extent do you have to provide services to everyone? To what extent do people learn from one another and go off and obtain services by themselves? And this is similar to Pascaline Dupas's work that she presented earlier on happiness on tap, that even the control group eventually gets treated on their own by learning how to take up the intervention. And so I'm interested in that, and I'm also interested in spatial spillovers, right? So if you actually put in an intervention, and again, based on the discussion that I was having with the practitioner organization, if you actually create these community groups, what is the spatial scope that these benefits might have, right? So at what point do benefits actually start decaying and really have no effect? So to summarize, and I'll stay very much within my 4 minutes, things that I'm really interested in looking at: water and sanitation, long-term sustainability of interventions, some banking and credit, and then generally the effects on in-migration of creating a policy, right? Do you actually make these areas better off? Do you actually just create more congestion, because the better off these areas are, the more people are going to want to move into them? All right, thank you.
How the poor are motivated to purchase and to use green technologies and health technologies. Also, I'm very interested in how we might provide the poor with financing options, so in particular loans or savings products, to allow them to purchase these sorts of technologies. And finally, I'm interested in how we can link the poor with global carbon finance markets in the cases where their activities are providing a global public good of reducing greenhouse gas emissions. Just a few relevant projects. I'm working currently in Dhaka on a couple of things. So the first being the use of micropayments, as I mentioned before, for adoption of ceramic water filters. So we know that that the poor appreciate water filters, and in many contexts, and sort of seem to want to use them, but find the large upfront expense to be exorbitant. And so what we're trying to do is understand, if you offer people a loan, if you offer people a savings product, how does that affect their willingness to pay, and what are the reasons for that? Why are they changing? Some of you who were in Dhaka a couple days ago had the misfortune to see my slides on the second project. It seems that trying to motivate, in many cases, motivate people via sort of a health message for reasons that Dan alluded to before, may not be sufficient to get them to take actions that we think are in their interest to improve their health. And so I'm looking at some alternative methods, which we discussed at Consuming Dirty Water, social pressure, feelings of shame, And you can think about applying those. I'm looking at water chlorination, but as Dan mentioned, it applies to sanitation, a number of other things. And finally, well, I'll skip the last one since it's quite speculative. But anyway, so why do I think this is relevant to you? I have my own reasons for being interested in these topics, but that's not the point. What I hope that I can contribute to is, first of all, helping you to improve the effectiveness of your interventions. I think many of you believe very strongly in what it is that you do, and with good reason. But we can always, I'm sure there are always opportunities on the margin to make adjustments and improve, and sometimes those are quite subtle. So hopefully we can work together to try to figure those out. And then the other sort of policy margin that I'd really like to work on is sort of understanding this trade-off between coverage, right, and sustainability. So we'd love to give things away for free as much as we can. As Pascaline's research has shown, in some contexts that's the right thing to do. In some contexts, it's a bit more doubtful. On the other hand, budgets run out, and so we'd like to improve sustainability. Was that one? Okay, thank you. And so part of the reason that I'm interested in the loans and savings products is for exactly this reason. How can we improve sustainability while maintaining, to the extent we can, coverage of not just the poor, but the poorest of the poor?
Good afternoon, everybody. My name is Anant Sudarshan, and I'm presently a postdoc at the Kennedy School of Government in Harvard. I wanted to give you a little bit of background about myself because I come from a slightly different academic stream to many of the other researchers who've spoken. So I come from an interdisciplinary background. So I have graduate degrees in mechanical engineering, and now I look primarily at the intersection of economics and engineering as applied to local environmental problems, many of which have everything to do with the urban health and environmental problems we see. So there are sort of two classes of projects which I think particularly interest me and where I think I have something to offer. One is the design of technological solutions, innovative technologies that are often engineered for extreme affordability, so to speak, that help tackle some of the problems we see in urban areas. And we heard a very good presentation earlier on the same sort of thinking applied to toilets. The second is behavioral techniques. A lot of the work I've been involved with recently looks at when we can't pay someone to do something, or when financial incentives are not the only method we have, how do we use information and other behavioral incentives most efficiently and quantify what they do? So for example, I look at how you can change energy consumption habits, but you could think of it as applying to water or other areas as well, energy consumption habits, by telling people what their neighbors are consuming or what their neighbors have done and how that can change behavior. And the last sort of area, which I think again spans a lot of my work currently is on quantifying health impacts from pollution. And primarily thus far I've sort of looked at air pollution, which is a big problem in urban India. Again, I think a lot of these techniques and insights translate to other forms of pollution. And in the context of water and sanitation, the contaminants are often either through groundwater or other modes of water pollution. So that's some of the projects I have ongoing, but I think basically that should give you some idea of where I come from, looking at the intersection of technology and economic and financial incentives, and also looking at how we can use behavior to change what people do, and behavioral methods and information where monetary techniques are not available. Thank you.
My name is Alessandro Tarozzi. As you can see, I am at Universitat Pompeu Fabra in Barcelona, GSC. I recently moved after a long spell at Duke University. I feel a little bit like a fish out of water here in a sense, because despite the fact that I've been around for a long time, I'm probably the oldest one in this group, although I'm sure it doesn't really show. My experience with RCTs is relatively limited. I've only been involved really very heavily in one large-scale randomized controlled trials, and also I don't have any previous work on urban areas in developing countries. So I'm going to just tell you very quickly a couple of words about what I've done and what my interests are. Very broadly speaking, health-related decisions among the poor. This big RCT I mentioned now is an RCT where we're looking at different ways of providing bed nets to poor people in rural areas in Orissa in India. The idea was, we know that there is this debate about free provision versus cost sharing. We wanted to see whether a third way consisting of giving nets, asking for the full price, but allowing people for repayment over time could actually lead to high uptakes. And from that point of view, the project was very successful. Unfortunately, when it came to health outcomes, the results were actually very disappointing. This will be reminiscent of the paper that Pascaline presented earlier, although in a different context. So I have earlier work on child nutritional and health status in India, although mostly from a descriptive point of view. My earlier work was applied but also methodological on poverty assessments and poverty mapping, in large part also with my advisor. I guess the tightest link with the theme of this conference is the work that I've been doing with a great team of people that have way more experience than I have about this topic on the choice of drinking water in Bangladesh. So there is this wonderful study done by this research team, mostly at Colombo University, that has looked at this really huge problem of arsenic contamination in tube well water that naturally occurs in many areas of Bangladesh, and we have been looking at mitigation mechanisms and how different ways of providing information can help people making the appropriate decisions from this point of view. So broad interests for the future and things that I'm interested in working on, again, very, very broadly, very vague. So testing new technology and solutions, pricing willingness to pay, and here really I could have used the first two bullet points in Raymont's presentation, more generally factors that affect demand for health protecting technologies, as well as factors that affect usage of these technologies conditional on access. I also want to point out the fact that I'm the only one with a tie in this group of 5 people. So.